The first doses of Pfizer's COVID-19 vaccine have been distributed across the U.S. About 40 million doses of the vaccine are expected to be shipped out by the end of the year between Pfizer and what we expect to be the Moderna vaccine. But all of that only means about 6% of the nation could be vaccinated before January. Healthcare workers are among the first to be vaccinated. Casey Pickering is an ICU nurse manager for the University of Kansas Health System and was among the first 5 workers at their hospital to receive the vaccine. Casey, first of all, thank you for just all the work that you do for your patients. Tell me, how did your hospital decide who would receive the vaccine first, and what was that process like?
Yeah, hi, thanks for having me. I got a call. We essentially, I think our health system went by looking at the frontline folks and those that are in the COVID units, taking care of patients, spending significant amounts of time with them, and looked to frontline folks from multi-disciplines and reached out. And I was super fortunate and honored to be one of those 5.
Well, I'm wondering how many people on your medical staff are expected to receive the first dose of the vaccine by the end of the year?
Yeah, absolutely. Hopefully all of them, as many as will and want to sign up to take it, which is the vast majority of folks. The call went out last night. I put the call out to my team, started signing people up, and I've spent the better part of the last 24 hours getting people signed up. So I anticipate that within a few weeks, we will have the majority of all of our ICU folks across the 3 ICUs that are taking care of COVID patients right now vaccinated.
And we're actually watching footage of you being vaccinated. I'm wondering, were you at all apprehensive about being one of the first groups to receive the vaccine? Did you have any concerns about side effects? Are you feeling anything right now that you can tell us about?
So my apprehension, no. I have much more fear and concern about COVID-19 than the vaccination for COVID-19. That was easy. I trust the scientists. I trust our leaders. I trust our health system to guide us on that. You do your research. You look at the numbers. And it was easy. I was definitely going to get the vaccine without question. How I'm feeling today, I feel great. People keep asking me that. I feel great. Lots of emotions go into getting that vaccine yesterday, ranging from excitement and joy and hope and exhaustion and everything in between, right? So it's a hope for a little bit better future for us, hopefully a little bit more living, a little less dying, but we know that it is not over yet.
Far from it, and we have been talking about just the extraordinary pressures that have been put on nurses like yourself, doctors, the entire healthcare system during this surge. And as much as we would love to just be celebrating right now the vaccine, the death toll, the number of new infections, they're just so horrific. You have been working with COVID-19 patients for months. Tell us a little bit more about what it's been like for you.
Yeah, well, first, I mean, we have an incredible team here. I certainly have an incredible team. As a health system, we have an incredible team, which makes the fact that this is pretty terrible a little bit better. But, you know, it ranges. Trying to explain it to folks that aren't in it is a really hard thing. I think of it as no matter what your job is or what your career, you have bad days, right? And usually those are one-offs. And for those of us specifically in ICU taking care of these patients right now, the hard thing about that is those bad days are most days. This is more death than we've seen in a really long time, ever, certainly in my career, and many of my colleagues and peers the same. And the complexity, the acuity of these patients is unlike anything that we have experienced.
Do you have the supplies that you need? Do you have enough hospital beds? How are you all holding up? I know you say that you have an extraordinary team, and we have seen that in action across America, just how remarkable all of you frontline workers are. But are you concerned about being able to sustain this? As we've heard from health experts, this might last well into when the snow is no longer on the ground, when in the springtime, possibly even the summer.
Yeah, a couple of your questions there. I mean, do we have what we need? We have what we need, and we certainly have access to leaders and folks that'll get us what we need if we don't. In terms of beds, you know, that's hard, given that we are a tertiary center and we get patients from all over the state, all over the region right now that fly in. Our helipad is directly above me in my unit. We know that most of those folks are very, very sick, coming to us as after maybe multiple calls, just trying to get here. And inevitably, it never feels like there's enough beds for everybody that we want to help and take care of here. So there's definitely that. The sustainability, you know, yesterday I told people it wasn't just a vaccine injection, it was a much needed injection of hope for all of us. And I felt that, and my team felt that, our team here feels that. So it doesn't negate the fact that we're tired. This has been a very, very long journey, but I mean, we are certainly in it to see it through, and hope's a pretty powerful thing. I think that it will most definitely carry us right on through this and see it on the other side.
Well, Casey Pickering, thank you for the injection of hope that you gave to all of us and all that you continue to do.
Yeah, thank you so much for having me.